Hello, hi, it's Dr. Erica. Thank you for joining me on this particular video chat. I'm going to talk about the aspirin enteric-coated product that is on the market. It's been on the market for a long time, and it's an OTC product that you can purchase for those who are taking a low-dose blood thinner or low-dose aspirin for primary and secondary prevention of atherosclerotic cardiovascular disease, which is going to be your strokes, your heart attacks, those who are at risk, and those who have a history of those items. Also, those who have a history of surgeries due to the coronary artery clogging, angioplasty, cabbage, all of those particular populations who qualify should be taking a low dose aspirin. Check with your physician first to make sure benefits outweigh the risk. Okay, so again, I'm going to talk about aspirin. Aspirin is available at 81 milligram, and of course, the guidelines recently published states that the low-dose aspirin can be utilized in those particular patients who have a history also of stroke and myocardial infarction. Again, those who are low risk for bleeding, and those who, again, who have been stable on this particular medication should continue unless otherwise directed by a medical physician. Okay, so American College of Cardiology, American Heart Association do recommend a low dose aspirin, and that's going to be your 81 milligram usually. But check with them first to make sure that that dose is appropriate for you. Okay, some of the side effects can be dizziness, can be also lightheadedness, nausea, and vomiting as well. It is enteric coated, so it's going to act for a little time in the GI tract to dissolve, and make sure that you're taking it with plenty of meals and food to help with that as well. Also, if you're pregnant, it's not recommended that you take this particular medication, so do please contact your physician first for an alternative. Okay, for pain, you can take it as well for pain, but in this case, we're using it as a blood thinner for daily use. And also, it can be swallowed whole instead of chewed or used as a chewable or used to dissolve in water. We want to make sure that we swallow it whole first for that best effect. Now, it is a medication that's going to help thin the blood as well as help with pain. So there may be some causes of side effects such as GI bleeding. So that is one of the risks that we are concerned about as healthcare providers, and that's going to be the GI bleeding. GI bleeding in those who have a low possibility of that adverse effect is encouraged to go ahead and continue with that medication. Aspirin inhibits or the effects of different medications, and some of those medications can be effective, and some can be adversely effective. So do be aware of those as well. There's not a large quantity of medications that it interacts with adversely. So just do be aware of that when you're taking the medication. Now, if you have a history of ulcers or a history of inactive ulcers that are currently not active, then you want to maybe seek a proton pump inhibitor in other cases where there may be an active ulcer on board, such as a omeprazole, a Prilosec, and then the Protonix or the pantoprazole are medications that you can take with aspirin to help reduce the risk of ulcers if that is your case. So do please check with your physician, and I hope this video has been helpful for those patients who are considering aspirin use and those who are new to the aspirin use and who are now being placed on this particular medications based upon guidelines and recommendations. So thank you for joining me. If you have questions or comments, please let me know. I'm Dr. Erica, and I hope to see you on the next video. Take care, like, share, and subscribe. Take care. Bye-bye.